Desde a antiguidade, grandes líderes das civilizações se reuniam com um único propósito:
Ever since ancient times,
transformar a
leaders of
saúde
great
através da
civilizations
melhora do
were
acesso.
united to transform health
E assim
through
nasceu
improving
o
access.
FIS, o
That's how
maior evento de
FIS
lideranças
was
da
born,
saúde da
the
América
largest
Latina.
event for
A cada
health leadership
edição, o FIS
in Latin
cresce e
America.
se
At every
modifica.
edition,
O seu palco foi
FIS
ficando
grows
pequeno
and
e teve
changes
que
and
expandir as
evolves.
suas
Our
fronteiras.
stage became
Ele
small
não
and we
só
needed to
conquistou de
expand
vez
our
o mundo
boundaries.
digital, como
We
agora o
conquered the
FIS
digital
21
world,
vem
and
acompanhado de
now
mais 2
FIS
eventos,
21 has
ampliando
2
cada vez
additional
mais o seu
events.
ecossistema
We are
dentro e fora do
increasing the
setor da
size of our
saúde.
ecosystem,
A
both
Iniciativa
inside and
FIS
outside the health
apresenta a
sector.
maior
The
experiência da
FIS
saúde da
initiative
América
introduces
Latina,
the
que não
greatest
fala
health
só sobre
experience
saúde.
in
Um
Latin
lugar
America,
onde
and
você vai
we don't
encontrar as
discuss
maiores
health only.
lideranças em
Here you can
diversos
find
setores e
the greatest
empresas,
leaders from
onde
different
durante
areas and
5
companies.
dias, mais de 20
Throughout
países,
5 days,
120
over
empresas
20
e
countries,
200 líderes
120
estarão
companies,
presentes,
and 200
em
leaders
uma
will be
plataforma
present.
digital e 3D com
In a
realidade
digital
virtual
platform,
e
3D
aumentada,
platform with virtual
proporcionando uma
reality and
experiência
augmented
mais
reality,
imersiva.
creating a more immersive
Serão mais de
experience.
80 horas de transmissão ao
We
vivo
will have
em
over
3
80
idiomas
hours
e
of
com
live
interpretação em
streaming
Libras,
in 3 languages
de
and also
8
with
a
sign
12 de
language
novembro.
interpretation. From
Prepare-se,
November
a
8th
FIS
to
Week
November
vai
12th.
começar.
Get ready, FIS Week is about to begin. Hello. One of the greatest news for this year is Meets. This is an event where our partners organize and generate content to transform health. We will have more than 20 companies bringing content and debate for the sector. Our first panel is Abrange, Brazilian Association of Health Insurance Companies, about the democratization of access to health. The moderator will be Marcos Pestana, Institutional Relations for Abrange, Carlos Augusto Ferreira, CEO of Humana Saúde and Director of Abrange, and Marcelo Dietrich, a partner at Dr. Clin and a director at Abrange, the Brazilian Association of Health Insurance Companies. Good morning, everyone. We are now beginning this debate promoted by FIS and Abrange. Today, we will discuss increasing access to health services. I wanted to give you a brief context, and then I'm going to give the floor to Antonio and Marcelo, who will be our speakers. The challenge in health has always been key to the life of the population. All public opinion surveys show this. And this importance of the health system was made even clearer by the pandemic. This became a central topic in the life of our population. In the last decades, Brazil had organized itself to face this challenge. We have a national health system, and I say a national system because, in fact, we have 3 subsystems that live together in tandem. We have SUS, which is the public health system. We have what we call the supplementary or additional health system that cares for 48 million people. And we have the direct payment system. That's where citizens go to a drugstore, to a health clinic, and they pay for their services, whether they are dental services, medical services. That's when the citizen hires these services directly from the provider. And the topic today is how to increase access. From a constitutional and legal perspective, there are no barriers or no boundaries because our system intends to be universal. There's no discrimination. Men, women, the elderly, young people, rich, wealthy, everyone is entitled to have access to this system. But of course, in real life, things are different because there is a severe bottleneck in the system because there's not enough resources. Of course, our Constitution ensures access, but we face severe problems in terms of the quality of services, long waiting lines, and the organization of the service, of the flow of services. And although the SUS, the system in Brazil, is a winning experience, it has existed for 33 years. It was established by the 1988 Constitution, but we still face many bottlenecks and difficulties, most of them connected to the lack of finance. Brazil has $350 per inhabitant per year to provide all the services. You know, that means from vaccines to organ transplants, heart surgery, anything is involved, but there's not enough money. On the other hand, we have a system that serves 48 million people. And there is an income issue in what we call the supplementary health system, private health plans. And throughout Dilma Rousseff's administration, we faced a problem. We had 51 million users, and due to the economic crisis, unemployment, this figure went down to 47%. And in 2020, we recovered 1 million new people that acquired a health plan. And we are right now at 48 million. But the barrier in this case is connected to income. When we think about the price of health insurance plans, or when the economy is undergoing a recession or a slowdown period, an important part of the lower middle class has to leave the private pension plan system and move to the public system. There is another discussion that's at the table of the Congress, the Brazilian Congress, which is to create new health plans, private plans, at more accessible prices that have outpatient units and also secondary services, which will allow to have a certain level of access for a larger part of our population. That's what we want to discuss this morning. So now I want to give the floor to Antonio so that you can begin your presentation.
I want to thank the FIS initiative for the invitation, as well as Bramji. And as a manager in this segment since 1990 or 1992, we've been monitoring for a while now and fighting for the segment. This subject is very important for the segment, the democratization of access to health. And we want to have a discussion at the end of the presentation, so we'll quickly cover a few situations, models, and considerations about the subject so that at the end we can have a discussion. As Dr. Marcos said, currently the universe of healthcare plan users has grown in Brazil with around 48 million users now. This is from a total population of 213 million residents in Brazil. And what we see is that we can grow by 77% without going into details of economic profile or purchasing power, we know that Brazil is now currently going through an economic crisis that tends to get worse moving forward. But when we look at these numbers, we also see them as opportunities and as a huge challenge for the management of products that can democratize access to health. Talking about the association, what we have on behalf of EMPREENDEDORISMO is an association with around 150 operators with approximately 16 million customers. And it is within that universe that we have small, mid, and large-sized operators that are present throughout the country. So from north to south, east to west, we are present nationwide, and that has to be respected. But how can we democratize access? And if we look at the operators, and if we think about models they can adopt to improve access, one first aspect that operators use to try to improve access are the management models. Operators as service providers need to constantly try to improve their management model. So what does that management model mean? A management model involves every area in operations, ranging from human resources, financial resources, material resources. It involves assistance, operations. Operators are trying to constantly improve these models with increasingly modern techniques to provide better services and to provide better and improved access. Another pillar to improve access to health is technology. Technology has improved and has been constantly improving access on the part of the population. One such example from last year is the remote medical visits or teleconsultations. And this is yet another access enhancing tool, another technology. And with the health techs, we're able to see some very interesting alternatives is the unified medical history for our patients. And that is an access related problem because for users that go into a medical office, whether it is a private office or an outpatient office, wherever, that patient needs to be monitored throughout their treatment, throughout their entire evolution, whether it is a surgical patient or outpatient or any level of medical care. So technology gives us alternatives to actually provide that. This certainly improves the cost outcome ratio. And of course, just as with every technology, there's a negative side to it. If it's not well analyzed in terms of impact and cost, new technologies currently, if they're not really well used when it comes to regulation, they can cause a very big problem in terms of the financial balance of the healthcare system. And instead of improving access, it can make it even more closed. Another interesting aspect when it comes to democratization, and Dr. Marcus talked about that, is that we now have a certain difficulty in terms of the accessibility of healthcare plans. One example that I like to use is the example of cities with a small level of capillarity, cities with 50 or 60,000 residents with a good hospital or good infrastructure, with no emergency services whether it is secondary or tertiary. When you have a global coverage plan, you often increase costs and render the plan unfeasible. So a new product opportunity or a product with a capillarity that's adequate for that type of reality, in my opinion, will increase the access on the part of that population without access to such product now. And one last item, and we've been discussing that for many years now. The market's become mature in that regard. It is a revision of the compensation model. We have to stop and look at the fit for service. We have to look at a system based on outcome, based on results, and based on really changing this outcome, because the fit for service is a very difficult tool to manage the system. And it's also important, as Marcos said, concerning the public health system and universal healthcare access. When it comes to that, we have to think about an item that is very dear to my heart. We have a situation where the more supplemental medicine is able to increase it in its number of lives in a structured and well-designed way, those users will come to the supplemental system, and the resources used by the public health system will be better managed and better offered to those that have no conditions to adhere to the system. So that's important for the system. We are improving as a whole of the three pillars that Marcus mentioned, the private, the public. So I want to leave you with these comments, and now I'll give the floor back to Marcus. And I want to let you know that I'm available to discuss my comments. Thank you. Thank you, Antonio. And now we'll listen to Marcelo and his comments about expanding access and making it more democratic. Marcelo, over to you. Good morning, everyone. Good morning, Antonio, longtime partners. Good morning, Marcus. It's a pleasure to meet you officially. And I'd like to thank Branchi for the invitation, and FIS as well. I'll quickly introduce myself. I'm a CEO and founder of a healthcare operator in the south of Brazil. And I'm an activist in this segment. I want to congratulate Justo, and we've been together in that for over 20 years. I founded the operator, and I've been working in this operator with for over 25 years. When I received the invitation, I must confess that I felt very comfortable to talk about the subject because we're one of the few states of Brazil with a good distribution of the outpatient plan, maybe due to the characteristics of our companies, and maybe due to trade union agreements that provided that the outpatient care is a minimal benefit, and maybe that's why we have this better distribution. And picking up on what Justo said, to organize our ideas, there are two very strong lines that we have to work on when it comes to democratization. One is the efficiency of the system, and using telemedicine to bring the healthcare plans inland to small cities, because with telemedicine, you can reach certain areas that it will probably be harder to reach with physical in-person services. We have several initiatives in parallel in Brazil of operators that are trying to integrate the medical history of patients with the accredited network. And that's a challenge, having this unified medical history. Access management, efficient services, offering the right services to the right people in the right location. So that's also a huge challenge for the healthcare system. Communicating and informing people. Health education is a key aspect of the health system, and the technology that's supporting all that. I think that all is within the scope of what operators have to improve. I also hear people talk about a product modulation, and I think this is another line we have to follow and think about on other opportunities. I've questioned that. And now we have an outpatient plan that's regulated with a set of coverages, which is in practice a more accessible health product. I think there may be small details in that product that if we were able to engage the regulators, and of course they have their own assumptions that have to be respected, but if we were able to promote this discussion to show that if we change the rules of urgency, emergency, the first 12 hours that sometimes lead to legal challenges, I think that it generates assistance and its availability, questions related to assistance and its availability. And sometimes people do not have the sponsors to give continuity to their care. So I think that this is mostly related to the healthcare aspect of it rather than the legal aspect of it. I think we already have products to generate better access to health, and maybe by making small adjustments to this product, I could give you the examples of urgency, emergency care, and also the oncological treatments, because the cost of next generation drugs really has a huge impact on the outpatient setting. So I would highlight these two adjustments that we have to focus on. I think by making small adjustments, we would have a product with a good level of price and access to a much larger population than what we currently have. A product that could compete with discount cards. When they give you a discount, it's almost like a reverse co-participation or co-payment. So my question is it really that complex? Making small adjustments to the outpatient setting, maybe in the hospital setting, this discussion is a bit different, or a bit more complex. But if we chose 3, 4, 5 different types of coverage to bring into the discussion, we could have a hospital product that is significant and relevant. And I'm not saying, who am I to say that this has to be maintained or eliminated? But for the people that are able to have a more complete product that already works, and we have products with co-payment that with we somehow, the legislation has already given us that and brought that into the game. So why not make small changes and create a second line of outpatient products and a second line of hospital products. I also think that creating too many lines would not be good for consumers because it could create segregations. I think that with the specific segregation that I'm proposing is related to extremely rare, frequent, and extremely high cost items. And maybe we should do a specific work related to that and remove from the public system maybe 5, 10, or 15 million people in 5 years' time. But then you could ask, well, are we going to be bringing transplantation and next generation oncology into the public system? Yes, maybe, but maybe dental services. How much are we going to remove from that system? Because I am an advocate for the unified health system. I studied it at university. I think it works in some locations more than in others. We have a system that generally works, but its biggest challenge is to give access to 150 million people. What I see in the regions where I work is that the public health system works for high complexity surgery. It works as a counter reference, even in the outpatient setting, but the public health system could bring about more difficulties for Brazilians that want to have a visit with the specialist and an echocardiogram, and sometimes it's 3 or 4 months before they're able to do the exam. And when the time comes for them to do the exam, they either no longer need it or they need something different. So to try to give my contribution, I could say that it's 2 major lines. For one, maybe with our leaders, Branchi has a very active president, Renato, and other extremely strong and solid entities in the Brazilian health system, hospitals as well, that can help organize this system, private hospitals. And there are so many other entities that could and are working in that regard. I know that. So there's this first line, which is a line of trying to create a higher efficiency in the system and more access, and for operators to become more competitive and more efficient, generating the best product at the lowest possible prices and the best access level. But there's also legal aspects and a more macro aspects, discussions that are huge to make health more accessible, and that really do not involve any operators, and whose decision so would have an irreversible impact on the health operators, because in the long run, it will significantly increase the fees, and that will restrict access, making healthcare access infinite is not the same thing as saying that health is infinite. What would be the cost of managing infinite health? You don't have to be a data scientist to come to the conclusion that this infinite access will become higher fees in the future. And then you'll start a spiral towards higher costs, less access, less coverage. And with that, you have more people inflating the public health system. I think I've covered my 10 minutes. Thank you. And I'll be available to continue the discussion. Thank you, Marcelo. So now let's wait for questions. I think our presenter will probably send us questions. And I'd also like to provoke interactions between Antonio and Marcelo while we wait for questions. Something that Marcelo said very well, we have to have predictability. You cannot have an open product. One of the central problems in an outpatient product is exactly the problem that Marcelo mentioned, which is the urgency, emergency, and that has a connection with the tertiary sector, and that introduces unpredictability into the. You know how it starts, you don't know how it ends. And having a clearer definition of products and having more transparency for users, for consumers, and clearly defining a product with primary and secondary care and all of the specialties and the exams, which is clearly separate from the hospital segment, including high complexity and emergency and urgency. With that, you could benefit millions of Brazilians with a plan and relieving the public health system. The cost for the public health system per user is 1,500 reais. So these 13 million that abandoned supplemental health and came to the public health system cost 4.5 billion reais per year, placing a burden on the system. So Antonio, maybe you could comment on what Marcelo said, expanding products. There's a special committee in the lower house. The ANS has been discussing that. So with small changes, we could be successful. What's your opinion? I'm in favor of this expansion, and I think that the example I gave you of a small hospital in small cities of Brazil with lower capillarity, that's one such example. The example I could give you is the Santa Casas. We have lots of such hospitals across Brazil, and that's a good alternative for the population. And improving capillarity in the smaller cities, if you do that, we could have better resources that could be very important in terms of providing better quality, more adequate services. And of course, that will not work if there's no use changing the product and making everything very clear. And if it is being interpreted the way they have to be interpreted, they could say no. But it can't be done. So I agree with Marcelo. But the product and its current adoption, the way it is now, it is imperfect. And for the population to be able to access I'm sorry, he's breaking up. There's no high complexity transplants, but we have other services. Sorry, he's breaking up. I agree with Marcelo. Marcelo, one criticism, I was secretary for 8 years in Minas Gerais, and the transplant queue itself, people with health insurance plans ended up having a privilege in the line, which is absolutely controlled and regulated. But when there was a compatible organ, people with supplemental health and with up-to-date exams would have a benefit, because people from the public healthcare system, their exams were outdated. And many people think that it's either all or nothing. You either integrate everything, or segmenting and offering a simpler product that's more accessible to more Brazilians, you would be denying it, and then they would have to rely on the public health system. But the early diagnosis of breast cancer and prostate cancer, it makes a difference. So having specialists and going into the queue earlier on makes sense. But there's this criticism that many politicians and many healthcare specialists, they'll say that either you have to offer everything through a healthcare plan, or nothing, because you cannot offer something that's segmented. How do you see that? Well, that was deep. Just as with everything in life, there's ideologies involved. I disagree due to pragmatic and logical reasons. I think that one thing that should be the basis of this discussion is that private healthcare should not be mistaken for collective healthcare. I think what differentiates this discussion is that we have to understand that collective health means that we have to give as much as we can to everybody. And then there's these aspects related to the universal aspect of the unified health system, and a private healthcare. If we consider that that's often quite expensive, I think that should be separate. But I acknowledge that that is a highly ideological discussion, and healthcare specialists, but I don't agree. I think that the number of people that we would add into the private system, with those people that would remain in the public system, we would be able to give them many more medical visits and services. So the private system customer could also use some public services, but isn't that the way it works? If my customer, for any given reason, had access to a transplantation through the clinic's hospital, and he undergoes a transplantation, it's the operator that's going to be charged. So the public system is already used, whether you have or not a healthcare plan. It's like that, but then the operator will compensate, but that's a financial discussion. We were not influenced by the all or nothing discussion. So that is my opinion, but I do recognize that it is an extremely complex situation that's highly influenced by ideological aspects. In February 2018, I was a congressman, and I organized a parliamentary mission with another 5 representatives to learn more about the Portuguese and Spanish systems. We went to Madrid and we went to Lisbon, and we visited primary care units, hospitals, outpatient clinics, and we also visited the parliaments. The Spanish and Portuguese health committees. And when we talked about judicialization, the Portuguese and Spanish would look at our faces and go, oh, what do you mean? It's something that they can't understand. This example-based and fee-based list. It is a decree that defines what the system is going to offer. And that is how it happens in Canada, France, the UK. That's how they work over there. So this is a Brazilian specificity. In the public health system, there is no list of procedures. It's an open thing. So it gets mistaken for this interpretation, everything for everyone. And on the other hand, in supplemental health, there is a list, but we're left with the discussion of whether it is just example-based. If you do not define the frontiers, how can you offer that to society and to users? So we have really to achieve a greater transparency so that consumers are able to tell exactly what they're purchasing. And there are some controversies. There have been some controversies in the past because the relationship of users and healthcare plans is contract-based. The relationship of citizens and the public health system is constitutional. It's citizens' rights. It's not consumers' rights. If you purchase a private healthcare plan, you're still Brazilian and still entitled to using the public health system. And the rule that the Supreme Court used was that the healthcare expenses could be deducted from your tax declaration. So that was the base of the discussion. So I think that we have a long way forward, and we've reached the end of our discussion. Antonio and Marcelo would like for you to say a few closing words. We have a commission with over 240 bills about supplemental health in the Congress. And we have this commission trying to synthesize and come up with a new regulatory framework, which is, and the report is about to be published. But what are the lines thinking about this government and the end of 2021 and 22? What are the essential transformations that ANS and the Congress and the Ministry of Health should produce in this period, in the short term, talking about 2021 and 2022? Antonio. Well, to answer your question, the market, in order to improve access, also requires better management and better practices, and needs to improve the way it manages resources. It also has to look into to look at the operator as a access path. And if we talk about the regulatory and legal perspectives, and reinforcing what Marcelo said, the legal framework needs to be made very clear. And with the support of the legislative. You mentioned that we just went through a review of many projects which are under discussion, and that has to be made clear. We know that there are representatives that want to put everything in the law. If that occurs, it won't make sense. It would be impossible to manage supplemental medicine. So in my opinion, what we have to revise is that we have to make the legal framework clear, what it covers and what is covered by the healthcare plans, and that has to be respected by the judiciary. We also need to do some work with the judiciary And they have to understand, like you said, that we are based on a contract with liabilities and duties and rights. So when it comes to the chamber and the Senate, we have to make that clear. In terms of the federal aspect and the executive, especially, our minister really needs to understand this dissociation between supplemental medicine and public medicine and our importance in the industry. It's 48 million people that are served by supplemental medicine currently. Marcelo, well, I think we have exceeded our allocated time. So I'd like to thank you for the participation and say that I'm available to become an advocate for the system. I really like what I do. And I would very quickly say that we have to regulate telemedicine and clarify that the list of services is being revised, and if possible, also bring more flexibility into the system, and that the judiciary also listens to the requests of society. I think this will give us a lot of work to do in 2022. That's what I wanted. Thank you very much. That's a great summary. Our discussion was highly productive. I'd like to thank Branji and the FIS initiative, and I'd also like to thank everyone who's watching us from home, watching this discussion about the bottlenecks and opportunities for expanding access to health. Thank you.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas, and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes. Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais
sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud4healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos, em pessoas que podem inovar e melhorar processos e serviços, e no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
So I hope you are enjoying our webinar. Please use the chat and the social media to let us know if you're enjoying this panel. Our next panel will be on safety in the health system. Our moderator will be Elio Primo. We'll also have the presence of Fernando Paragon, who's a director for Pro Saúde, and Alfredo Tavares, who's an oncological surgeon at the DOOR Hospital Network. Let's get started. Good afternoon. I'm Elio Primo. I'm a director and coordinator at the Hospital Casa chain of hospitals. I'd like to thank FIS for the invitation. I'd also like to thank Dr. Alfredo Barisi for his presence. He's an oncological surgeon at the Casa Hospital in the DOOR chain of hospitals, and Dr. Fernando Paragon, a medical director. The WHO defines patient safety as the absence or reduction to acceptable levels of the risk of undergoing unnecessary damage during any health-related treatment. In 1969, there was a report issued by the Institute of Medicine of the United States that concluded that the specialized services were not free of failures, and that there was a high probability of causing adverse effects. To reduce damages related to healthcare, the developed countries have concentrated their activities on citizens, especially starting on the 21st century. All of the modernization strategies should focus on improving healthcare. In that context, patient safety is one key component of medical services. And now I'll give the floor to Professor Alfredo. Thank you, Elio, and I'd like to thank Paragogi and the Casa hospitals. Thank you for the invitation. This is undoubtedly the most important management congress we have in Brazil in the health sector. Safety is a gap between two accidents. There's accident A, accident B, and safety is a safe space between them. I spent several years in the Brazilian Air Force, where I had the opportunity and the privilege to interact with pilots. And we worked with one tool that's widely used in the aviation market. And you're probably wondering, what about this famous singer that just passed away in an accident? How can you explain that and say that it's a safe activity? Well, the first thing is we don't know the cause of that accident. It usually takes something between 6 months and 12 months to find out the causes of an accident. But if you look at the number of accidents that occur in aviation, and the number of people that resort to healthcare services, it's a huge difference. It's much safer to go on board of a plane than being hospitalized for any procedure. In the administration sector, like ours, what can we do to improve patient safety? Paragon is doing a great job, a very interesting work in the healthcare system, and we'll try to summarize this so that in the end, we have some time to discuss and exchange ideas. What we did during all of these years was, we developed accreditation systems and a series of very important measures, but nothing is better than training people technically with realistic simulations. And especially working as a team. The healthcare system has a huge difficulty in working as a team. The rotation that these professionals go through is extremely high. Nursing technicians represent from 80 to 90% of all of the workforce in the healthcare system. And it's very, very rare to find professionals that have remained in the profession for longer than 15 years because they simply can't stand. The salaries are low and there's an extremely high pressure. And we have to find solutions for that, and that depends on administration. And healthcare is a process that involves many people. Who's the captain in a surgery room? I don't know if it's the surgeon, the anesthesiologist, or the assistant. So what we're doing in terms of using aviation tools and applying them to the healthcare system is to apply them to a setting, the healthcare setting, which is extremely different from that of aviation. The number of adverse events that occur with a hospitalized patient is huge. If you go to a hospital, you'll see that there are many abnormalities happening, and the huge majority of those abnormalities will not lead to anything. And since that's the case, many people think that there's been no mistake, which is different from what is right, which is totally different from damage. When a patient falls and breaks their leg, or if there's an infection that's completely avoidable because you've left a vesical catheter for longer than you had to in an elective surgery, that makes everything much more expensive. So investing in safety should be our #1 priority. The Brazilian Air Force works with the Flight Safety Department, and that's the same thing in the airlines. And you in the Medicine Central have created that possibility for hospitals. And the vast majority of hospitals in Brazil do not have a safety hub, which is a mandatory tool, as well as notifying adverse events. We have around 300 abnormalities, and we need 30 accidents to have a severe lesion. If we studied the 300 accidents where you have no loss of life or loss of material, it would be much cheaper, and we would avoid the 29 very severe accidents or a fatality. And that has to be changed. In aviation, starting in 1977, after the Tenerife accident, they started thinking about a tool called Cockpit Resource Management, or CRM. Now it's called Company Resource Management. And that tool discusses communications, interpersonal relations, decision-making processes, error management. All of the factors that occur in the aviation setting are the same factors that occur in a medical setting. We gave training, and Parago was one of our initial collaborators. And we've trained almost 2,000 people in both civilians and military personnel. We discuss safety culture. We do not discuss the culture of the organization. A training given in the Air Force, for instance, where I stayed for 15 years, it's a different hospital than the Air Force hospital. And the course that I gave in the Navy is different as well. That applies to public hospitals, which are different, as well as private hospitals. But the safety culture is the same. We cannot change it. So we tend to do copy and paste, thinking that you can buy a product as a package, but that will not work. So that training has to be customized. And another important thing is that we're having a unique opportunity. We're currently giving that training in the medical school of Sociais and the Federal University of Rio de Janeiro. And that's been a fantastic experience. Since the beginning, medical students have this exposure, but hospital training is multidisciplinary. So we need pharmacists, administrative personnel. We have to train the team, which does not equate to giving lectures. It's a slow process that has to be rectified. There's no use doing this now and only doing it again 10 years from today. And another thing, which is fundamental, is that we also have to have the role of a clinical director of the hospital, and that's really well defined, and that's a unique person in that process as a whole. So this is what I wanted to say, and this is a summary of what we believe to be the one of the several tools out there to improve safety and to mitigate mistakes. One thing are the mistakes, and a different thing is damage. You can do something wrong, and simply damage will go unnoticed, and people may think that there's been no mistake. Thank you very much for inviting me. Thank you.
Thank you. My name is Fernando Paraguay, Dr. Fernando Paraguay. Yes, good afternoon. I wanted to thank you for the opportunity to be here participating at FIS Week. Hey de casa, Dr. Alfredo, thank you for the invitation. It is an honor to speak a little bit about our experience. And in the practice of a manager that works in an institution, it's a nonprofit organization that manages hospitals in different ways. We have our own hospitals, we have third-party hospitals in 11 Brazilian states. So we have different cultures in our network, and we need to establish safety standards so that the health organizations and institutions can act safely. As Dr. Helio said in the beginning, there was a discussion earlier in the century about mistakes, and we've learned a lot in the last 20 or 21 years. And we were supported by the aviation industry. I did a lot of study about that, and I learned a lot with Dr. Alfredo on how these models of risk activities, such as aviation, and we could also mention the oil industry with oil drilling platforms. Today, we have platforms to assess adverse events that comes from what was designed after a fire incident in a British oil platform. But we are a different industry, of course. The variability in our professional activity in health organizations is greater than in nuclear industry, oil industry. And these variations, to an extent, they ensure results somehow. There is a writer who writes about strategies for the safety of patients in real time. I've blanked about his name, but in a minute I'll remember. Well, variations can be necessary for health institutions because they ensure results. Oftentimes we look at something that went wrong. We had 10 events, one went wrong. And the 9 that went right, they had variations, but still they went right. So it's important to see what are the variations and what variations take the favorable outcomes and how we can act so that we are not, we don't have our arms tied for our professional activity. I was recently in a flight to Curitiba, and my flight was at 10 to 7. And we had boarded already to this flight. And there is a safety procedure, of course, for the aircraft, and they detected some non-conformity, and the flight was canceled. I had a very important meeting. I had to sign some papers, and there was nothing I could do. The flight was canceled. In health services, it might be different. We have a patient who comes to the emergency room. They need surgery, for instance, an emergency surgery. To have their vital signs, they need resuscitation, but surgery has to be done anyway. And this ability to be able to variate is important for the health system so that we can keep on providing positive results. This has to do with practical matters. We've evolved a lot with recent legislation, 529. It came about only in 2013, and it's our legal framework to care for our patients. We have protocols. Dr. Alfredo drew our attention to that, but it's much more common today that we manage hospitals, and these hospitals have their own protocols, their safety protocols, protocols for patients, systems for notifications and alerts so that we can communicate about adverse events. Also, this legislation states that there should be support for institutions to implement their patient safety actions. And I think that in this legislation, we need to move forward in terms of training, I would say. So I'm very glad to hear that, now in medical schools, in the syllabus, you are discussing the possibility of teaching risk management for students, medical students. We have some hospitals that are also medical schools, and our professionals, they have no idea of the risks involved in their activities. So just as pilots face this situation, aircraft pilots, they didn't face the situations before, they think that it's normal after a 24-hour shift. They think that they're going to have the same reasoning capacity. They have not been trained to understand the risks of the activities that they perform. And I think that this is something we still have to work on. It's a weak spot, and we need to evolve in this area. There's also another important topic that has been mentioned before. How can I approach safety in my health institution or organization? How do I treat safety? Well, of course, talking about patient safety, it's a trendy term now. We have many events about this topic. Many people have a degree in risk management and health, but how do we manage our networks? How do we manage our institutions in terms of health? As Dr. Alfredo Guarici said, each different institution has a different culture, but the safety culture is one single culture. There are values that are completely attached to any safety culture, and they have to exist in all institutions. But how can we do that? How can we make this happen? Currently, when we see many fusions, we have a small hospital. It used to be an individual, a standalone hospital, and they were doing fine. And then a large hospital network acquires this hospital. How do we make this integration between health protocols? We have to take advantage of the embryos, quote unquote, existing in institutions. We have to take advantage of that. And how do we work with that? How do we measure how we are moving forward with our safety culture? Well, currently there is a form of safety measures. There is a survey, actually several surveys, but the most prevalent one is the hospital survey on patient safety and culture, which brings us different dimensions and information that we need to work, identifying which values are present or not in the culture of that specific institution, and what do we need to embed in that institution. But we have to be careful not to lead to distortions. We know that it's complicated to talk about mistakes. If I speak about mistakes before a training, such as the one Dr. Alfredo is conducting, we might not reach the expected results from the medical staff and from the manager. The manager might understand that he has committed a flaw, and they might want to hide it. it's not uncommon to see in hospitals managers that require us not to notify. No, please do not notify this. Otherwise, my boss is going to see this as negative in terms of my performance as a director, as a manager. So let's not register the incident. And that person in that case clearly was not trained to work with these topics. So if we rush too much, if we have a cookie cutter receipt, and if we push our own model and I say, no, my network is doing this and not elsewhere, well, it might not necessarily work for safety. So it's really important to look carefully at this subject to ensure safety in the system as a whole. And last comment I'd like to make is about the response given from society to mistakes in the health system. We have our councils, the Federal Board of Medicine or the Federal Council, and we have also councils for other medical areas and professions. They still lead these cases oftentimes the regional council, and we work with different regional councils in Paraná, in São Paulo, and different Brazilian states. We see that we still don't have a common understanding about the importance of looking at different processes behind eventual flaws. The legal system, on the other hand, oftentimes does not help in developing a positive culture in health systems. I'm going to mention the case of the girl that received Vaseline. There were two vials, exactly identical. One was a hydrating solution. One vial had Vaseline. The label was wrong, and it was printed. They were in the same cabinet, so that was a mistake. You know, someone made a mistake, and someone gave her Vaseline. And what did the legal system did for this intravenous Vaseline application? Well, the family went to court, and damage and mistakes are different things. When there's damage, the legal system should intervene so that there's compensation for the damage. The nurse received an accusation of homicide, and I might have grabbed the wrong vial myself, you know, because they were identical, the labels were identical. So there was a mistake, there was a flaw in the system that led to that. And after this case, the system did not improve. So the legal system, if we have these arbitration chambers, arbitration courts that are mediators in these situations, we have insurance companies and compensation is paid, like in the aviation industry. We compensate the families, and they have to be compensated. But how are we going to improve safety? Is it accusing someone of homicide? Or should we maybe blame the institution as a whole? You know, the institution should adjust its conduct. Wouldn't that be a better outcome? And the press, I would say, the media. The media could talk about adverse events just like they do in the aviation event. We've recently had an air crash with a famous Brazilian singer. No one has blamed the pilot so far. All major networks, CNN, Global Television, all networks are clear. They say we need to investigate the causes of the accident. Of course, they give relevant information. If the pilot had a license to fly, if the aircraft had a license to fly. And the goal is to stop accidents like that to happen again. So society and the press, they should face adverse events in the health industry the same way. I guess that was my overview about the difficulties that we face. We don't have a lot of time, but I'm available for the Q&A session. Thank you. Thank you, Fernando Paragó, for your brilliant explanation. Safety is key for the good situation, both in the private and public health system. So thank you very much for your explanations. we will have now a Q&A session. May I add a comment? Yes, of course. There's something interesting that I wanted to mention. It is not exactly clear what is the role that people play in the system. When Mr. Parago says that some managers have difficulties in discussing mistake because of the reputational damage that might cause, they are making a serious mistake. Making a liver transplant or a heart transplant, it's undisputable that there is inherent risk. It's different from doing a C-section, of course, but people can pass over in both surgeries, although one of them has a lower mortality level. But any human activity has or involves the possibility of human flaw. On the other hand, we see a concern with using electronic medical records and using processes as if we were factories. This is excellent for well-defined processes. I would say clinical exam labs, using AI for imaging exams. I am sure that this is going to be an amazing contribution. But we still need human beings to feed these systems and to train these AI systems. So the technology has a lot to offer. And I think that electronic records, medical records, are a challenge. They are poorly conceived. In general terms, they have many advantages, but I think we still lack what we need, which is to obtain data connected to safety. And what can we learn from possible mistakes? Also, institutions have a lot of difficulty in discussing among themselves, discussing their problems among themselves. We need more space and more discussion areas. I'm doing this with Rede Casa and Rede Door, 2 hospital networks. So this is a completely different work when compared to São Vicente Clinic. And it's different from the new hospitals of Rede Casa. Different institutions have different cultures, even within the same network of health institutions. Each one has their specificities. So safety needs owners. Mr. Parago talked about the low level of involvement of physicians concerning safety. And I think that nursing is way ahead of physicians, pharmaceutical sector, they're much more focused on safety than physicians. And I think that we always discuss, we don't discuss a mistake in assistance or in services. We always talk about malpractice, which is a problem of terminology. Good health professionals that make a mistake, the life of that professional comes to an end. A piece of that person also dies. So we have to protect the second victim, which is the professional that made a mistake. As Parago mentioned, we have the Vaseline case, and then we had a case of coffee and milk. All these were mistakes made by nurses, but they are tagged as medical malpractice. There is no medicine with physicians alone, but there's no medicine without physicians. And it's great to have this opportunity to warn. I hope that we have several managers, health managers, here with us, and look inside. We have a lot of talent inside, and it can help us to develop this process. Of course, we can search for outsourced support. This is normal, but we need people we need in-house people. In 3 months, if we don't have an accident, something's wrong. There is always a possibility of a mistake. It's impossible to spend 10 days in a hospital after a surgery and everything being 100% perfect. There's always a small thing. And with the small thing, there's no damage. But that small thing might be the grandparent or the parent of a fatal accident in the following month. Yes, yes, you were saying very important things. You really summarized what we said. René Malbert was the author of the book I was trying to remember. And he says that it's, it's different if you bring inside the health system the investigation of mistakes or malpractice and control practices that will decrease the risk. Oftentimes, it's almost impossible to do a different activity because there are many bureaucratic obstacles, and then the professional, the health professional cannot perform his or her activity correctly. And as I said, it's different from an aircraft in which you just cancel a flight. Oftentimes, an emergency surgery has to happen no matter the conditions. Regarding what Dr. Alfredo Guarici said, and I wanted to highlight that, we are talking about non-intentional flaws. And this is very different from a criminal action or from a breach in legislation. No one supports that. We have the fair culture, what we call the fair culture, and it has specific criteria. Does this person deserve to be held liable, accountable, or is this the flaw from a whole system that was poorly designed? That's a question that we have to ask ourselves every single time, and we have criteria to answer these questions. Was the person properly trained? Were they constantly trained? Is there a procedure in place? Was there a pressure time involved? Was there enough people, or is this person maybe doing double shifts? This has to be designed to protect health professionals and also to hold them accountable when there is some breach, intentional breach in legislation, and when someone needs to be held accountable. We have to remove rotten apples, of course. And Parago, those of you who have, these very different cultures within your system, I've been following up on your work. Can you tell us a little bit about your experience doing that? Because the DOOR network of hospitals is a very challenging example. They have almost 70 hospitals in different regions. Now we have Rede Casa also with 11 hospitals. It's a different challenge. How can we work with these different cultures within the same network? Yes, as you said at the beginning of your explanation, we need to respect local specificities. Oftentimes we have been working for more years in safety, and we think we're going to get to a new hospital and do everything the same. This is a mistake. It's a very serious mistake. First, we need to get to these new hospitals and institutions and understand the culture of that institution. What do they already have in place? What embryos, quote unquote, in terms of patient safety and quality they already have? Their internal team, they probably have professionals who know the institution. Well, let's use their knowledge. Let's use this team. And we also should identify using well-established tools. We have an auditing tool that we use in our institution that is capable of running a diagnosis of quality processes for patients. And we have quality and safety surveys as well. What values of the safety survey are in place? What values should be developed? What existing values are positive? This is very interesting. We can even use these positive values into other hospitals of the network, because a new hospital that was recently acquired might have a process that is better than the one we currently have. On the other hand, we might say, well, maybe communication has to be improved. People are afraid of reporting on incidents. Do you really understand what is the role of safety in your institution? It's not a cookie cutter recipe, as you said. We need to be humble. We need to listen and understand that there are different cultures. And it's not because they think differently that they are worse, but it's important to know where do we want to go and what are the values that lack in that specific culture. That's how we've been able to evolve with safety. We currently are the nonprofit entity that accredits the largest number of hospitals in Brazil. So we are capable of evolving with this process in many institutions. You mentioned accreditation. Helio, I'm sorry if you wanted to say something. Do you think that accreditation is key? I don't think it's essential, but here in our institution, I like to say that my mom, and you know her, my mom thinks I'm the best surgeon in the world. That's what she thinks, but I'm not. Dr. Alfredo Guari, she's certainly a better surgeon than I am. I know I'm not the best surgeon. My mom thinks I am. So we look at accreditation as a person that is not our mom, and she's assessing our way of working. Of course, we have to look for serious and earnest institutions that are capable of doing this assessment. We do these discussions with our accrediting institutions. We always require seasoned professionals. We know the professions, so we know who has the right vision. I want them to look at our institutions and say, what is wrong here that I'm not seeing? And how can I improve as a surgeon? Please give me a positive criticism so that I can improve. So in that sense, I believe that accreditation can be a fundamental tool. But I agree with your mom, I have to say, you are an excellent surgeon. Yes, Parago, you mentioned something really important. Accreditation is indeed a very important tool that has to be fostered. However, accreditation does not end when you receive the certificate and hang it in the wall. Yes, that's when everything begins, actually. That's the beginning of the process. So during the accreditation period, the hospital, is in a boiling point, and then when the accreditation process finishes, it's as if people forget everything. I've been working for many years, and the special operations police forces, they are not accredited. So we need, and they do an excellent job anyway. Accreditation organizations, they are responsible. If an accreditation agency tells you you are accredited, they are giving you a green light. And medical schools should also be responsible by the professionals that they are placing in the labor market. As physicians, we have to discuss the possibility of having a test for physicians to join. We've been having several legal cases, several claims, and that's a response from society of the lack of the inability to meet fair requests. When we need to apologize, when we need to do crisis management to explain something that is unexplainable, we learn and we grow. It's like teaching our children. If we are not tough with our children, they will not learn the right lessons. So institutions need safety policies and protocols, and we have to separate mistakes from breaches, from crimes. We cannot accept breaches of legislation. When that happens, the institution and the managers have to act. In large hospitals with several services, a patient comes through the emergency unit, they go through X-ray, they go to surgery, and then they go to intensive care, and things get complicated. They go back to surgery, then they go back to intensive care, and then they are admitted out of the hospital and they die. And even in hospitals, we have cultures, different cultures within the same hospital. And this is something that scares us. When we think about something that is systemic internally, oftentimes we don't have what we need. Some hospitals are doing this very seriously, which is clinical meetings where complications are discussed, and there is real interest in having the appropriate environment. No conversations in the hall, no conversations in the cafeteria, serious scientific discussion, and we would all benefit from that. From a management perspective, what is the cost of a patient having a lesion because he fell down from the bed? It's much more expensive than training a professional. Yes, Dr. Helio, I'm sorry, I think our time is up. Yes, we don't have any additional questions, and I think we are out of time for this panel. Helio, you work at the cancer hospital, and it's not very simple to deal with the everyday of our colleagues, everyday routine of our colleagues, but we are working hard, and I think that all hospitals should try to develop leaders that will spearhead this process. You know, otherwise we will not move forward in terms of safety. And I think that safety being one of the items in important symposiums like this one will help us to improve and to learn. There's a word that I learned the other day. Safety is the cheapest item when it's second-hand. When I learn safety with my own mistakes, it's much more expensive than when I learn from mistakes that happen next door. And we need to have a clear, honest, and friendly way to share our mistakes in an appropriate manner. We should discuss our flaws and our mistakes so that we can contribute to the most beautiful thing in the face of the earth, which is one human being caring for another human being. There's nothing more beautiful than a human being caring for another. Physicians, nurses, therapists, we are carers. We care for people. That's what we do. That's our job. We care for people who are sick and not the other way around. Oftentimes, we treat diseases and we forget to treat patients. But I think we should be careful, care for people. Thank you, Mr. Parago and Helio, for the invitation. It was a pleasure to be here with you. It's such an important panel. Thank you. Thank you, Alfredo Guarish, and thank you, Fernando.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela Saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
Quando falamos em educação na saúde, falamos em conteúdo, aprendizagem, criatividade, sonhos, tecnologia. Falamos sobre BKL. Com foco na geração de soluções educacionais para o que a saúde do futuro precisa, o IBKL gera conteúdo e soluções para que os profissionais e acadêmicos possam ter uma nova experiência no aprendizado e na capacitação. Gamificação, árvores de decisão, 3D, inteligência artificial, realidade virtual e aumentada. Usamos tecnologia de ponta para melhorar a experiência, sempre focado no usuário. Esse é o novo IBKL. Esse é o IBKL+.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Eles são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que tem feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa!
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
Quando falamos em educação na saúde, falamos em conteúdo, aprendizagem, criatividade, sonhos, tecnologia. Falamos sobre BKL. Com foco na geração de soluções educacionais para o que a saúde do futuro precisa, o IBKL gera conteúdo e soluções para que os profissionais e acadêmicos possam ter uma nova experiência no aprendizado e na capacitação. Gamificação, árvores de decisão, 3D, inteligência artificial, realidade virtual e aumentada. Usamos tecnologia de ponta para melhorar a experiência, sempre focado no usuário. Esse é o novo IBKL. Esse é o IBKL+.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch, we are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
We will now have a panel organized by THB, and the topic is health insurance in Brazil and in the world, before, during, and after the pandemic. We will have today Eduardo Comar, who is Health and Benefits Vice President at THB, and he will be accompanied by Lior Baruch, Senior Executive at Siga, and Heitor Augusto, who's Director of Relationship with Clients at SulAmérica. Hello, good afternoon, everyone. It is a pleasure to be here with you in another panel in which we will discuss, talk, and learn more about such a fascinating market, which is the health market in Brazil and in the world. First, I want to thank FIS, Rodrigo, for the invitation to be here. And I wanted to thank my dear friends who accepted this invitation to be part of this conversation, Heitor Augusto and Lior Baruch. I wanted to start by sort of breaking the ice and moving away from our protocol. I wanted to dedicate this conversation to Dr. Eliud Baruch, who passed away last week. He's the father of our colleague Lior Baruch. And Dr. Shoshana, he really insisted for Lior to be part of this panel. To both of you, I wanted to say that your son, whatever you are, is an amazing person. He's a spectacular person, and we learn a lot from him. We exchange so many ideas. So congratulations for this amazing son that you have. My dear friend, I know this is a very tough moment for you, and thank you so much for joining us, regardless of this difficult moment you're going through. Having accepted to be part of this conversation, we are very thankful for that. And Mrs. Shoshana Baruch, this presentation is for you and to Dr. Rodrigo Baruch. Okay, my dear colleagues, let's talk about the topic of today's conversation. And the idea here is to discuss everyone today speaking about health insurance. And with the pandemic, all of us either began to understand more about this topic, or at least try to understand more. And I think that the result of that is anyone who thought we understood anything about the topic, we don't. We realize that we don't. And we are going to talk about the world market, where Lior is very much present. And Heitor Augusto is also an expert, focusing mostly in the Brazilian market. And we know that in recent years, we are seeing some difficulties in this management, so that we can care for people, we can care of people's health, knowing that cost is an increasing cause for concern, mostly in the Brazilian market, where we have an instability in the number of people who have access to this system. So costs are completely divided, and the number of beneficiaries or users remains stable, mostly because this is connected to the economic development of our country, we know that we need all stakeholders to work together so that we can create a more sustainable health market. So after this introduction, I wanted to briefly talk about my dear friends, and then you're going to have the floor so that they can tell you a bit of the experiences that they've lived and their learnings, and how our collaborative model can be improved so that we keep on working for many years to come in a market that needs to be sustainable. So Lior Baruch has an amazing CV, and I am proud to be able to read it. He's lived in 4 different countries. He's fluent in 5 languages. I met Lior in a conference in Berlin where I watched his presentation, and I heard him speaking for the first time. I was wooed by his presentation, and we became good friends. He joined Cigna in 2012. He works with the global departments at Cigna. He was medical director, well-being director. He was the director of the network of providers. And he's also led global programs for emergency. He has broad knowledge about the health problem in Latin America, and he has been key to support several partners in the business matrix. Before Cigna, he was a medical manager at another insurance company, health insurance company. He began his career in Brazil, then he moved to Dublin in Ireland, where he worked to expand the network of providers and in managing complex cases globally. He has expertise in the health insurance sector, and he is also a surgeon, a trauma surgeon, and he has also worked in emergency services in São Paulo. You have the floor, Lior, my dear friend. Thank you, Eduardo. Thank you for the beautiful words you've said, and thank you for the invitation. It is a pleasure to be here sharing this panel with the dear friends that I see on the screen, and it's a pleasure to be here with everyone that's watching. I think this is an opportunity for me to learn, because listening is maybe more important even than speaking. Since we don't have a lot of time today, I'm going to try to be brief. 2019, before the beginning of the pandemic, health insurances was the segment of the insurance sector that grew mostly in the world, 6.9% when compared to 5.9% in 2018. And of all collected premium around the world for different types of insurance, health was responsible for 26% of this whole pie, insurance pie. And back then, the conversation was a bit different. We were talking about how to integrate different costs in health insurance. How can we create a less fragmented ecosystem, a less isolated ecosystem, and bringing value-based healthcare? And this was a conversation that that had been going on for many years, with different creative ways to add value to a local health insurance watched or covered by the global health insurance. And how can we be ahead of competition? Every year in the US, where I am right now, if we use 2018 as an example, we received 50,000 requests of quotes to serve clients. And in the blink of an eye, 20,000 of these requests, 40%, were declined. They did not even do an actuarial study because we could not serve the client's needs with high quality as the clients received, providing value for the premium that they pay. And what do I mean by providing value? Well, we have to be able to show that there are going to be safe costs. We have to show the network of clinics and services and drugstores and pharmacies looking at fraud combat. And that was the second year of our telemedicine program, in which we used an app. And in the company, everybody was wondering, why aren't people using telemedicine that much? We knew about the positive impact and the value that telemedicine could bring. Well, late 2019, early 2020, the pandemic hit. And I think that the legacy, as you mentioned, you used this word, the legacy left by the pandemic was telemedicine. In Brazil, we saw the reform of this regulation and the boom of the use of telemedicine. In Brazil, there was an increase in 4 percentage points in the use of telemedicine. And the more people use telemedicine, the more value patients see. Patients need primary care, and they could avoid going to an emergency room in the middle of a pandemic. I know it sounds obvious, but when the pandemic was hitting hard, who would be willing to wait for service in an emergency room because they had a sore throat? And people were dressed as if they were ready to face a surge of Ebola. So people really started realizing the value of telemedicine. One of the challenges was to provide assistance and services in a world that came to a stall. Our clients, they had to be transferred to an excellence center in the case of an emergency, should the level of local care be inappropriate or insufficient. And I clearly remember of a patient who was in Vietnam. He had a hernia, a disc hernia. He needed to undergo surgery, and we could not transport this person to the nearest center of excellence because the frontiers of countries were shut down because of sanitary measures, health measures. And that was an extremely dramatic case for us. So luckily, let's use this word, luckily this person was a US citizen. He had to cross the world, fly across the world, go to Texas to receive surgery. Another challenge we face is one that shows the consequences, which is search for chronic diseases and catastrophe diseases for this type of healthcare. Patients took a while to search for help because they were afraid of the virus, or we've had some late diagnosis that appeared, delayed diagnosis. And we know that the sooner we have the right diagnosis, the greater are the chances for a healing treatment, an effective treatment. So I think we will still see the impacts of these delayed searches for care. In the beginning of 21, we had the beginning of mass vaccination. And as we have vaccines being distributed around the world, there was the equation that was going on. And now we add more complex challenges. Patients with what we call prolonged COVID, people who avoid the vaccine, and also the need to fight fake news, using science, which has been complicated. And we can even speak about a new pandemic, which is a mental health pandemic. I just wanted to add that regarding prolonged COVID, almost 1 out of every 3 patients that had the disease and did not go to hospital, they're still complaining about fatigue, loss of the smell sense or of the taste sense months after the diagnosis. And these patients will still need chronic rehabilitation services, which is quite a complex service, and we have to support these patients. Regarding vaccine hesitancy, the World Health Organization brought a lot of information in a very simple and accessible language to the whole of the population, fighting fake news. And, I would say the BS even that has been shared through social media. We were looking at terrible fake news, and the despair together with ignorance, they succumbed to this type of rhetoric. In Zimbabwe, I heard that some people were refusing to even think about taking a vaccine, and they said that it was a white people thing. This is for white people, just like HIV. And what we believe it's going to be a difficult challenge to manage is the current mental health pandemic. How can we provide the necessary care to fight the mental health pandemic. And this is not just about a clinical program for clients showing what are the health service providers that we have, or providing new apps. Actually, how can we engage patients? How can we attract patients when patients need to treat a mental health problem? Oftentimes, they are not even aware that they need treatment. 1 out of every 4 people will have depression, and they are not even aware of that. Mental health is not something isolated. It's part of a package called holistic health. That's the psychological, physical, and social well-being of people. Just to finalize my comment, I wanted to bring up a topic that might fuel our debate this afternoon. Physicians who know their patients, are they capable of identifying these symptoms of mental health problems beforehand, which would then allow to provide more effective services? I do believe yes. The answer is yes. But as I said in the beginning, I want to hear from you, my colleagues, and I think this is going to be an amazing conversation. Lior, yes, as usual, you are a professor. Just making a brief comment before I give the floor to Heitor Augusto, you mentioned 3 key points that I wanted to sort of highlight with a yellow marker, quote unquote. And these are things that draw my attention. I believe we are undergoing a perfect storm when it comes to the use of health services. And why do I say that? Well, we still have a remainder of the COVID pandemic. We have elective surgeries coming back because, the economy came to a halt for physicians and health service providers who provide elective services or elective surgery. And we also have, as you mentioned, treatment. If we forget OG and some cases that needed to keep on being cared for, all other groups of diseases and treatments came to a halt, and there was no appropriate prevention or follow-up during the pandemic. So now we are seeing more severe cases coming to our offices. And that, of course, elevates costs and elevates expenses, medical expenses. And I also agree with what you said about the post-pandemic period and mental health issues. You can call it burnout, you can call it stress, but this is a very serious problem. It's a silent disease, and oftentimes it's very difficult to identify it. And together with that, engagement, as you mentioned, engaging patients. I think this is a huge difficulty. I usually say that we currently have 4 generations in the labor market. Soon we will have, 8 generations. And they have different perceptions, different values, different purposes, different goals. And we have one single way to communicate with all these patients. How can we expect to have different outcomes or different reactions if we have one single way to communicate with people who receive the information in a different way and who have different goals? So yes, this is a challenge that we are facing. And I think it's important to talk about this, to exchange ideas so that we can search for a common ground. Or, I know that we have the car going at high speed and we have to step on the brakes, so otherwise we are going to hit the wall. And we need to do that to be sustainable. So thank you once again for your words. And Heitor Augusto, you are another great friend. He's been working for 25 years at SulAmérica. He has a degree in business administration. He has an MBA at the FGV University in São Paulo. He leads the commercial and client relationship area at SulAmérica Seguros, a SulAmérica insurance company. He probably started working when he was 12. I don't know. He probably joined as a trainee. Anyway, he is a dear friend and an expert in this industry. It is a privilege for me to, be constantly exchanging ideas with him. Of course, we do business together, but I think we have a common philosophy and common values. We are looking at improving our health insurance market so that it's more sustainable, of course. Heitor, I give you the floor, and please tell us a bit about your experiences and what you've lived during the COVID pandemic. What have you learned? What have we done? And what do we still have to do looking forward? Thank you once again for accepting our invitation, and you have the floor.
I do. First, I'd like to thank you for the invitation. And Lior, it's really nice to meet you. I'm sure we're going to have the opportunity to have lunch together and further our discussions. Lior already mentioned some very important aspects of what I'd jotted down as a priority for our conversation. And well, talking about the pre-pandemic scenario, we know that this crisis is going to bring about change for the entire market, the economy, and society. And it's had an impact on the way we live, the way we act, the way we work. I think we all noticed that both companies and professionals, I mean, the insurance companies have had and still have a very relevant role in the market, which is one of offering safety to the population. This has increased the perceived value, in my opinion. Some cases that Leo touched upon, Sigma's challenges are much greater than that of SulAmérica. We do have our own regional challenges. We are present in many places in Brazil. And, well, I can only imagine you with your much more scattered population. And the pandemic brought about this huge challenge in terms of the insurance companies being able to manage their plans. So several removals have certainly saved lives. I saw this very intensely with my customer relations team, transferring people from Manaus to Brasilia, from Brasilia to São Paulo and whatnot. And I mean, so many lives were saved. So in its moments like this that end up drawing people's attention to the fact that it is important to protect whatever they care about. So our reality, and Lear, I think you know that very well. You lived here as well as Edu, but we should not forget that we have some challenges such as judicialization and population aging, which is putting more and more pressure on us. And young people, they're increasingly not adhering because we have financial compensation. The retraction that we went through in our sector in the last 3 years, the total number of beneficiaries of medical plans and hospitals has decreased by almost 3 million users. And I have some good news for you. Today, the agency disclosed information about the September data. In 1 year, we grew by 5 million, over 5 million beneficiaries, 3.3% as compared to September 2020. And we hit a record in terms of the number of registries. We had 48 million beneficiaries. Now we have 48.566. So this is the highest number of beneficiaries we've had so far, coming from a huge retraction, which is, of course, a sign of an economic recovery. The growth was not in terms of individual or collective health plans, but rather it was seen in business plans, collective business plans. And with that, we see that the economy is starting to recover. as a result of the strong vaccination campaign in Brazil. Brazilians traditionally like to vaccinate, as opposed to some other regions in the world, such as in Europe, for instance, where they're facing the risk of a new wave of infections. And going back to the subject matter of this discussion, the incorporation of technology is always putting pressure on costs. There's X-ray, but there is CT scans and MRIs, and of course, this puts pressure on costs. Our inflation's always going to be higher than the general inflation rate, and I think we should keep an eye out for that. Fraud, that's something that's highly prevalent in our reality. We have anything from excessive, unnecessary treatment to low service quality or inadequate selling of materials and medicines, tax evasion, fractioning invoices. Many people don't know that that's a fraud, and that also puts a lot of pressure on the sector. Around 20% of the cases in supplemental health come from fraud or waste. And there's one thing that Leo talked about, which is the compensation model. And what we see most frequently is the fee for service model that rewards for mistakes and generates complications and poor results overall for the model. Here we created demand for service because the more you do, the more you earn. And I speak on behalf of Sul America, but we're implementing more and more differentiated compensation models. The market's been working, the hospital chains have been starting to understand the need for changing the model because, in fact, consumers are putting pressure on us towards presenting more sustainable models. And this is also related to compensation and service providers. I think the market has to evolve more towards a greater transparency of costs and prices. Maybe this could be a way for beneficiaries to choose more efficient providers. And we have to discuss that. And Leo, you mentioned engagement. I think that engagement of beneficiaries is fundamental, especially when it comes to primary care, secondary care, and changing our model and changing our culture. That's important, but the engagement of the stipulants is also very important, and they have little participation in the discussions. They have almost no interest in transforming the market, so probably they could be more active in those discussions and require more information from the operators, become protagonists regardless of the hiring model, and working in Brazil. I think that very few companies face healthcare management as grown-up people. So well-being of collaborators and engagement and engaging them in self-care is a fundamental part of this transformation that we still have not achieved, which is very important for people. I think that HR has to see that as what they want to deliver to its employees, to its to the family members of their employees, and so forth. And the HR is increasingly losing strength. The procurement department, I have nothing against them, but they're not specialists in that segment. So they put unnecessary pressure if we talk about the procurement model. And I think that the operators themselves, maybe we could work better in that regard in terms of the management of healthcare services. And we have several players that are very important for that with us. Going back to another subject that is also challenging, in my opinion, apart from the GDP and the job positions and the number of beneficiaries, I think there is a change in consumption habits with the increase in available technology. And we were able to use that in a very accurate manner, in that we were able to turn our attention to telemedicine. At Sul America, we had a service even before the regulation came about, which we called a medical screening. And just so you understand, Lear, we were already challenging the model at that time with telemedicine in a very shy manner due to the absence of regulation, but we already did some screening for simple questions from our beneficiaries, but with no prescription, so it was not really a medical visit. And we had more or less 2,000 people looking for that service per month. With the pandemic, we went over 100,000 services per month, and we were really able to leverage that technology and really give that support to our beneficiaries, and that continues. Even with the recovery, of elective services, what we can tell is that the population likes telemedicine, and we have to provide that. And Lear, I don't know how you've been dealing with that, but Brazil used to be a country where people would frequently go to the ER, and even mothers would go to pediatricians through the ER services, but of course that was a totally mistaken way of looking at it. I think that the pandemic showed to us Brazilians the risks of being inside an emergency room and exposing your kid to a situation where other kids and other patients are there with other diseases. And we saw that that is becoming less common. So that is a positive impact of the pandemic in our case. I think we shouldn't miss the opportunity. We have to continue encouraging people to only go to the emergency room if they have an emergency. And as a market, we can create mechanisms along with hospitals to deal with these situations. And to live through the pandemic, talking about the backstage a little bit, we created several ways to steer the beneficiaries away from ERs. We did a fast track methodology where the beneficiaries did not have to wait in line in an ER. They would go to an ER that we would refer them to with a pre-filled registration form, and then they would be screened, and that would prevent them from having to be in the same room as other beneficiaries, thus avoiding contamination. And that's something that we maintained as a delivery that we deliver to our beneficiaries. And there's also several other things. Technology, of course, helped us a lot. And service providers, the fact that they are able to understand this new moment that we're in right now, such as home delivery, for instance, of medicines. That's something that we also offer, avoiding patients from going to hospitals. At home blood collection, we led this initiative, and this will also prevent beneficiaries from unnecessarily going to a lab. And just to wrap up, and I'll give the floor back to you in a minute, we've always tried to keep our beneficiaries at the center of our perspectives, regardless of where their point of contact is. They're all going to be connected constantly within our coordinated care initiative, which is an initiative that deals with primary care. And we've always tried to keep beneficiaries at the center of every situation and clinical outcome, regardless of the situation that we're now experiencing. Thank you. I learned a lot from you. Time flies. We only have 5 minutes to wrap up. But I think, as you said, we have several problems and we need to raise greater awareness and engagement. We have to discuss judicialization. We have administrative problems of not including procedures into the list of procedures, and this interaction between procurement and HR. And all of these problems leave all of the parties involved unhappy, consultancies, businesses, beneficiaries. So we need a coordinated action across the sector. I don't know if we have time, but I want to start the conversation and ask you to say some final words about my last comments, which is primary care. And in such a fragmented sector, how we could avoid incurring more costs and maybe having telemedicine more prevalent, but as a deeper form of medicine with family doctors at the top of the chain in the private market, so that this culture can then be disseminated to all beneficiaries, and as Adu said very well, generating greater engagement by the representatives of collective insurance policies. But anyway, that's food for thought. I'd like to once again thank you very much for the excellent discussion. Unfortunately, time flies. Lear, once again, thank you so much for your availability and for your knowledge. Heitor, thank you as well for being with us in the middle of your vacation. So you have a minute each, Lear first and Hector. Thank you very much. Thank you for watching us. Lear, you have the floor. Thank you, Eduardo. In 60 seconds, I want to highlight the positive aspects. Talking about Brazil specifically, we're seeing an initiative where we have products around a healthcare team revolving around a primary care physician. We don't need an endocrinologist to treat diabetes. We don't need a cardiologist to treat high blood pressure. We don't need an endocrinologist to treat obesity. 27% of the Brazilian population is obese. This is a huge leap if we compare today with the situation 20 years ago. So this physician at the center of the team will be responsible for making the connections. And of course, he or she owns the patient. And then they'll consult with a specialist. Then the patient will come back. So this physician will be providing a holistic care to their patients. There's a lot to be said about that, but let's park the conversation and discuss it at a different time. Thank you for the invitation. It was a great discussion. And in closing, and picking up on what Leo said, our perspective is that primary care takes care of health in general by creating a connection between patients and the medical teams that will follow those patients throughout their lives. And that's the message that we've been advocating for under our coordinated care initiatives. Talking about cost, that was something that we were talking about the other day. but we cannot yet measure accurately. But we know that according to the WHO, preventative care like these are able to cater to 80% of patients' demands, like Lear said. And in addition to that, according to the World Bank, you can reduce the number of hospitalizations by 17%, 29% of emergency and urgency services, and 30% of hospitalizations. So that's what we believe in. That's the take-home message. Congratulations on the event, on the choice of subjects. Probably the subject in itself would deserve 3 or 4 hours worth of discussion, but I think it was quite good in that we were able to share our perspective. So yeah, see you next time. Thank you. Thank you very much. Bye.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o Prontuário Eletrônico do Paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
abrange e completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
Quando falamos em educação na saúde, falamos em conteúdo, aprendizagem, criatividade, sonhos, tecnologia. Falamos sobre BKL. Com foco na geração de soluções educacionais para o que a saúde do futuro precisa, o IBKL gera conteúdo e soluções para que os profissionais e acadêmicos possam ter uma nova experiência no aprendizado e na capacitação. Gamificação, árvores de decisão, 3D, inteligência artificial, realidade virtual e aumentada. Usamos tecnologia de ponta para melhorar a experiência, sempre focado no usuário. Esse é o novo IBKL. Esse é o IBKL+.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we are here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch, we are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos.
And to finalize the panels of comments in our first day of event, we will have a very interesting topic. This is a panel organized by PRONAP, and we will talk about how to connect the ecosystem at home. And we are going to have the presence of Eric Barbosa, Vice President of Ambulatory Care at B. Brown. Good afternoon, everyone. Good afternoon, Felipe and Eric. It is a pleasure to be part of this panel. And I want to thank the FIS initiative. We are having a little bit of an audio problem with Mr. Bruno's audio. The booth apologizes. And we will talk today about caring for patients at home. How can we treat all players involved in this ecosystem? The interpretation booth apologizes. We cannot hear Mr. Bruno's audio. Well, good afternoon, and thank you, Bruno. Your audio was freezing a bit, but I guess we can understand a little bit. So good afternoon, everyone, and thank you very much for joining us. I want to thank the FIS initiative for the invitation to be part of this panel, which connects the ecosystem to patients at home. This is a very important topic for us at B. Brown. I am responsible for the ambulatory care business at B. Brown, and that's what I do almost every day. I'm looking at how our tech initiatives, our initiatives in terms of processes and connectivity, how important they are to ensure the connection with the patient that is at home and needs a service and care. So I'd like to make a 10-minute introduction, speaking a bit about how B. Brown is doing within this ecosystem. B. Brown is a company that is 170 years old. We are a family-owned business, and we have been in Brazil for 55 years. And in these 55 years, we now have 3 plants in Brazil, EdTech, TID Medical, and EdPharma, bringing a lot of German technology to our country. And ensuring that patients have access to hospitals, to health professionals and patients. This is really important in this ecosystem to ensure that this happens. B. Brown today can deliver 17 different therapies in the hospital and extra hospital. This is infusion, nutrition, anesthetics, dialysis services, and treatments for infections. Many things we can now support health professionals and mostly patients. Looking from a perspective, thinking of what we search for in terms of providing access to patients who are at home, not just in home care services, but chronic patients, patients who are at home and need outpatient care. So patients with diabetes or high blood pressure. And Brazil has an aging population that is growing and that needs care in their everyday lives. So today we are bringing to Brazil some important initiatives, not just in terms of technology, to ensure that these patients, even when they are at home, they have access to the level of service and care that they receive in a hospital, but also programs, different programs. So B. Brown currently has the Celebrate program, Programa Celebrar in Portuguese. We help patients when they are discharged from the hospital, and we provide a lot of information about how their life is going to be outside of the hospital when they go home with a home care support, or how can they continue their therapy and their healthcare throughout their lives. In this program, we work together with hospitals when the patient is discharged, because this is a very important moment in patients' lives. When they leave the hospital, both for the patient, for caregivers, family members, they need to be sure that the treatment, the therapy, is going to continue in an appropriate manner. And the Celebrar program brings this care for these patients, whether they have been hospitalized or whether they have specific nutritional needs. I am responsible for the outpatient unit at B. Brown, and I have been working with some very relevant topics so that we can increasingly decrease the gap between the care we provide in a hospital and the care we can provide at the patient's home. Of course, we face some dilemmas when we do that. Transfusion systems or infusion systems, dialysis services for the home environment. And we still face some dilemmas in the market, some barriers, whether they are cultural, technologic, or even in terms of confidence, so that we can bring these technologies and implement them effectively, both for patients and also for health professionals to feel safe, and the hospital that is discharging the patient so that they feel safe, that there will be a continuity in the care for this patient at home. Looking at this difference that we currently have regarding the hospital and the home environment, we do have some specific discussion points that we are going to cover in this panel. It is a fact that the patient at home has considerable decrease in their costs. The costs are lower than at a hospital environment. And of course, if we use technology, connectivity, and other things that are very important for us to continue this journey. And we have to test these services in the home environment. So the main focus is the well-being of the patient. They need to have a safe environment. They need to trust the care that they will receive at home. Of course, we have to look at costs and who will be paying for these home services, and we have to look at the efficacy of these services that are provided at home. I wanted to give you the floor back, Bruno, so we continue with the panel, but that's a bit of how we look at caring for our patients at home here at B. Braun, and B. Braun is a technology company. Yes, B. Braun is an excellent partner. The interpretation booth apologizes. We are having audio problems with Dr. Bruno's connection. Well, Bruno, my apologies. We cannot hear you very well. I believe you gave me the floor. And first of all, I wanted to thank for the opportunity of being here. I wanted to thank Rodrigo and the whole FIS team who can be part of this panel. I wanted to take this opportunity to briefly tell you a bit about my story, our story here at my company, and how we can bring technology and processes to the home care environment. I have been working at the health area for 18 years. I've worked at Bardi and JJ. I've worked at GE. And I've spent some time at Sodexo as well. About 5 months ago, I joined Pixel. Pixel is a health tech company. Actually, we've consolidated different health tech companies. We have a track record of 18 years. We are a little bit younger than B. Braun. Anyway, we were created when Intel Capital, an investment fund, merged two different companies, Medical Systems and Pixel. These companies had a focus in radiology. So that they had PACS, which is the image part. They manage image services, and RIS, which is a system that manages imaging clinics. We also had Riverwood Capital, which is another investment fund, a US investment fund. And that allowed the company to acquire other companies, to enter the lab market through a lease system. We have HES system as well, which is hospital management services, and some other small companies that joined the group. So the idea is to really be part of the whole health system, and that's how we can follow up on the patient's journey and make it easier. That leads us to the moment where we are right now. How can we lead technologies that today we have inside hospitals to make it possible that more people can be served at home? First, because this decreases the cost for the system as a whole. And as you know, these costs are increasing year on year. So this also improves the quality of life of patients. It fosters the use of technologies. Diseases that did not have a cure now do have a cure, or it can be managed. But that all comes at a price. And then we need to find a balance so that the benefit brought about by technology can be accessible to the population and not just to a minority. And that's when we see reduction in efficiency levels. Home care is an important tool for that. First, because if I am sick, I'd rather be at home if possible. If I can be treated and cared for at home with the same level of safety that I have in a hospital, I would rather do that. And I believe that most of the population would rather have a care at home as well. Also, how can I take all the technology and all the equipment that we have in a hospital to people's homes? And one of the major challenges that we face is connected to something that Eric mentioned: cultural barriers, and oftentimes some technology barriers as well. Many of the systems we have today were created to be used in hospital settings, and they're very complex. So oftentimes, when you have the patient at home, you don't have appropriate equipment. If you want to have a cutting-edge iPad or a cutting-edge computer in the hands of each health professional and different nursing professionals or caregivers, it would not be feasible. So oftentimes, even the network connection that you have is not enough to use the equipment. And at the end of the day, that hinders the use of programs that demand a good internet connection. So the challenge that we have is, how do we take the patient's journey, how do we transfer it to the home environment with a technology that is accessible to this population? That's what we're working on at Pixar. We are already in hospitals and in clinics and in imaging centers and labs, and we know how these systems work. So we have an interesting part of the journey covered already. We can connect, for instance, electronic medical records to the patient's home, but how can we do that in a way people can use it? So we are working on this right now. We have an AI tool that's called Louis, which allows us to connect electronic medical records and other exams and tests to tools that are easier to use, such as WhatsApp. So one of the ideas that we've been exploring is how can these people enter this digital journey in a more accessible manner. We are developing an electronic medical record that can be updated through WhatsApp, or a medical test that can be delivered through WhatsApp. Today, 100% of the Brazilian population probably knows how to use WhatsApp. My grandmother, who is 95 years of age and is in a home care institution, she uses WhatsApp. So this is a way to make these services more accessible to nurses, to family members who oftentimes are part of the process. And also, how can we connect all these amazing equipment? You know, we have wristwatches that can measure body temperature, oxygen levels, heartbeats, blood pressure, and also emergency ventilators, for instance. How can they communicate in a better manner with cell phones or other equipment so that this information does not have to be typed? And we see this as a journey. It's going to begin in a more simple way, and the complexity will increase. The functionality will increase through time. You probably remember a while ago, you needed physical air tickets. You needed to take paper to the check-in counter if you wanted to travel. And today, if you don't have luggage to check in, you can just check in with your cell phone, and it's almost a contactless process until you get inside the aircraft. You just have to show the QR code and you can board a plane. And that's what we believe also for the health system. We are developing processes that help health professionals and family members so that they can be able to use these tools in a more efficient manner.
Sorry, Bruno, we are not able to understand what you say. We can't hear you. I'm sorry. I'm sorry. We apologize. The translation booth apologizes. He's breaking up. Like WhatsApp. So that are able to integrate the entire ecosystem. And that's what we're talking about, not only in terms of our multidisciplinary team, but also our partners such as B. Brown. So now let's talk about electronic medical records for home care patients. We apologize, Mr. Bruno's audio is breaking up. I think your question was about having an electronic medical record focusing on home care, right, Bruno? Yes, that's right. Well, we already have electronic medical records for clinics and hospitals, and we've been developing an electronic medical record that connects all of the other medical records, and that can be used in a home care setting. The medical care tool itself is very flexible, and of course, it tends to become stronger the more partners you have working on it. And that's interesting in the health sector. There are several companies that set out to solve specific problems. For instance, there are companies currently that are highly focused on providing drug-related solutions, defining which drug can be given at which dosage and so forth. So ideally, there should be a communication between the medical records and that type of tool. There are tools for monitoring and tools that are pre-programmed to follow the blood pressure of the patient and the ECG of the patient. It can tell whether there'll be a problem or not. So it's about connecting these tools. And one thing that we've been focusing on is how to implement these medical records in a simpler manner so that it's easier to access. And at the same time, that it provides safety and security when it comes to data confidentiality and to access by suspect individuals or hackers. So it's all about reaching this balance between these situations. When you're at a hospital or at a clinic, of course, you're in a controlled environment, you know what you're accessing. But if you go to a home care setting, that is no longer a controlled environment. So that's a challenge that we've been facing. And of course, we have to reach a balance in terms of how much protection we want to add, and how easy we want to make that system in terms of access by the patient and in terms of patient safety. Bruno, picking up on what you said, I'm sorry, Bruno, picking up on what you said, we were talking about technology, but we have enough connectivity nowadays to feed into these electronic medical records. So in theory, no one has to touch those devices. There's an infusion pump, which is the space pump that's fully connected to electronic medical records. Once you prescribe a specific protocol or specific medication, this pump will then establish a connection with an electronic record, and somebody can have remote access to those data. And the same thing applies to dialysis machines that also transmit the entire dialysis session, any type of incident or any type of medication change. So these protocols are already in place. And we talked about that. The technology is there, but the biggest challenge is cultural and structural in nature. And I think we have to tread a path towards that with the therapies that we can apply at home. We have a limited number of therapies, but actually there are countless possibilities, such as dialysis at home, for instance, parenteral nutrition at home. And I think we have to cover these steps before we get there in the future. Yes, I think that home care has to go through that iPhone moment, as it were. If you remember, back at the time, the technologies used by the iPhone were technologies that already existed in the market. The other smartphones already had them, but no company had been able to use them intuitively and set them up in a way that was easy to use. I think we're reaching that point. And I think that one thing that will really help us out is 5G, in that it gives us the capacity to establish better connections and transfer more data. And also the speed is much greater. So 5G will allow us to expedite that process. But certainly these tools must be easier to adopt. Otherwise, the adoption is going to be easier. It's going to be slower. Yes, and I think that there'll be a positive impact on cost effectiveness, making the process more accessible to the paying sources, because that is also a challenge right now. Yeah. Right? We have to prove to the paying sources that it's easier and cheaper and more effective to do that at home in a manner that is intuitive and efficient. Yes, and you can also create great benefits when patients at home. Well, that's a totally different thing in terms of patient comfort and the cognitive aspects, because patients are in a setting that they're familiar with, and that helps with the recovery and also in maintaining the cognitive functions of patients. And I can tell that based on my grandmother, when she was in a hospital, she got much worse, but when she came back home, that was a huge improvement for her. So the more we can provide people with well-being together with clinical care, the better. Well, when it comes to costs, Eric, that's a constant fight, right? That we have with operators. And we've been trying to implement new programs and bring them into home care, such as the shorter hospitalizations for specific treatments, whether it is with antibiotics or stomach-therapy or simply for physical therapy. And the hospitalization should have a beginning and an end that's pre-scheduled, and so that within that time frame, we're able to show our customers, which are the operators, show them how important it is to provide our patients with home care. I think that that's something that is very clear to families already. Bringing patients home. As one of our founders used to say, it's not about adding years to your life, but rather it's about adding life to your years. If you take the patient home, you can avoid infections, cross-infections that usually happen at hospitals, especially because patients are weaker. And undoubtedly, the at-home treatment is much better in that regard. I think Eric had talked about a problem called Celebrar, which focuses on home care patients, right? Would you like to elaborate on that, please? Sure. The Celebrar program is a free of charge program that supports hospitals and institutions in the hospital discharge for patients with wounds or problems in the urinary tract. So as patients get discharged with a new chronic condition, we have a highly specialized nursing team. And when they get discharged, then they are referred to a rehabilitation center or elsewhere if they have to deal with the colostomy or live with the wound, and in terms of nutritional support as well. And with that program, what we see is that patients will often leave the hospital. And as I said in the beginning of my speech, it's extremely important and complex to have the patient go through the moment of hospital discharge and make sure that they'll have enough guidance, information about their new condition if they're a chronic patients. So this is what this program is for. We help them and we refer these patients so they have a better quality of life when they go back home, whether they're staying in home care or if they're resuming their normal lives. There is a toll-free number. You can call B. Brown and request that program for your hospital. Well, that sounds great. I think that has a great connection with our service, and I have no doubts that B. Brown will certainly be instrumental in helping us providers in this home care setting. Felipe, you also talked about how easy, quote unquote, it is to maintain an information, a data system inside a hospital with everyone at the same address. And we in Pernambuco, we have approximately 500 patients at home, each one with their own reality at home. And we see high-class patients and low-income patients. So sometimes they don't even have access to basic conditions. So how is, I guess my question is, apart from WhatsApp as a tool to provide guidelines in terms of treatments and the clinical conditions of patients, and apart from that, does Pixel consider working with the management of home care and something from an administrative perspective or related to the business itself? Well, Bruno, it's a market that we've been assessing, and it's a growing market. We think that we could add value to it. This is still under study. This is a tool that is still being assessed and being studied to define if it will get good support. So where we see that we can add more value to our companies, that first, by being able to use AI to help us in the decision-making process. That's already been used at labs for more critical programs, sending them to more specialized physicians, and not so critical exams, and sending them to less specialized physicians. The more we digitalize that data, with digital prescriptions and data, patient data, exams, I think this intelligence, the artificial intelligence, will become more and more helpful in helping us make our decisions. And we are more or less in the process of implementing protocols to help us make our decisions. Another very interesting thing is that when you collect this data from the internet, if you have to switch from one healthcare practitioner to another, that it becomes more fluid. If you have different shifts with different nurses or different physicians, if the data is digital, that can be done over the internet with online tools instead of them having to physically go there. You can also start making decisions as to whether it makes sense to discharge the patient or put them in home care. So you can also define the type of care that it can provide. So I think that these tools can be useful in that regard. Another aspect that was also mentioned by Eric concerns providing data where you can prove that that is the best or most effective treatment that you can provide. Hospitals work with lots of data and graphs that help them make decisions. And I think that home care still has a lot to do in that regard, especially because most data is not yet digital. Yes, even though it's a service that's been used for over 30 years, the difficulties imposed by the fact that each patient stays at home, this is a difficulty in and of itself, and prevents us from better integrating the entire ecosystem. Thank you, Eric. Thank you, Felipe. It was a huge pleasure to be with you. We're closing our session, and I'd like to thank everybody from FIS Initiative, Rodrigo and others, and I am sure that this project will continue to grow. Thank you, and have a great day. Thank you. Thank you, Rodrigo. Thanks, everyone. Thank you, Eric. Thank you. Goodbye.